Osteotomy. Joint deformity correction. Osteotomy is a surgical procedure that involves cutting and reshaping bones to correct deformities or realign them.
Main types of osteotomy.
Here is a general overview of the osteotomy procedure. Anesthesia. Osteotomies can be performed under general anesthesia or under regional anesthesia. Incision. The surgeon makes an incision over the affected bone, providing access to the targeted area. Bone cutting and reshaping. Using specialized surgical instruments, the surgeon will carefully cut and reshape the bone according to the preoperative plan. Fixation. After the bone has been reshaped, the surgeon may use various techniques to stabilize the bone in its new position. This can include the use of screws, plates, rods, wires, or external fixation devices. Bone grafts or spacers are added to achieve the desired alignment or correction. Post-operative care. Pain medication and antibiotics may be prescribed to manage pain and prevent infection. Rehabilitation. Following the surgery, you will likely undergo a period of rehabilitation and physical therapy.
Genu varum or bow leg deformity correction. Genu valgum or knock knees deformity correction.
The details and techniques used can vary depending on the individual case, the bone involved. It's crucial to consult with a qualified orthopedic surgeon who can provide personalized information and guidance based on your specific condition.